Welcome to the Uzima Health and Wellness Podcast.
What did the doctor say?
Describe in one of your videos the difference between a habit and addiction. Because some people say, I'm not addicted. I can stop whenever I want to and have demonstrated that ability. So can you talk about that? Can you explain that?
Yeah, that's great. A great distinction to make because it becomes unclear in a lot of ways as well, as you mentioned. So in a habit, we often try and describe it in terms of what's happening when you perform a specific action. So a lot of times, I like to let's use a little, like a benign kind of playful example of thinking about a vending machine. If I went to a vending machine, and I'll use my own self because I like Skittles. If I go to a vending machine, I put money in and I get those Skittles out, then I've gotten that reward. So I'm performing the action because I'm getting something out of it. If I develop a habit, I'm going to go to that vending machine and put money in regardless of whether I get Skittles or not. And I'm not going to be able to stop because now it doesn't matter what the outcome is. It's just something that I'm going to do regardless. So when we think about that in terms of substance abuse as well, so those two pieces do actually go together. So there is a habitual drug taking that can occur regardless of what the outcome is. And that's one of the 11 components that's associated with addictive-like behaviors as well. But that can extend to other areas as well. So it's not just a habit, but it's also sometimes continuing to use the substance if there are negative consequences associated with that. So whether that's physical consequences, interpersonal, psychological consequences, continuing to use that substance despite the detrimental components that are associated with that. There's also additional components like craving. So the habitual part that we think about is just one component, but in terms of addiction and abuse, it's a much larger array of behaviors that somewhat are associated with habit. But to your example, if someone is able to quit and stop, that would suggest that they haven't developed it into a habit at that point. Because if they're no longer getting the good outcome, they are able to stop that behavior. But it's an important distinction to make.
Hi, Uzima family. If you like what you're seeing and what you're hearing, subscribe to our channel. Hit the bell icon below to be notified of our recent videos. What did the doctor say?